Hello everyone, welcome to Hair Info channel. My name is Daisy, and in this video, let's talk about Aldactone. In this video, we will help you answer the question: what is Aldactone? What is Aldactone used for? The contraindication of Aldactone. How Aldactone works. What are the side effects of Aldactone? And some safety notes relating to the usage of Aldactone. Now, let's begin. Aldactone is a prescription medicine used to treat the symptom of high blood pressure or hypertension, low potassium level, hypokalemia, and heart failure. Aldactone is also treats blood retention, edema in people with congestive heart failure, cirrhosis of the liver, or a kidney disorder called nephrotic syndrome. This brand belongs to Pfizer. The medicines were initially approved by the FDA in 1960. Spironolactone is the main composition of Aldactone. Aldactone comes as a tablet that can be swallowed, and it is available in 3 strengths: 25 mg, 50 mg, and 100 mg. So, what is Aldactone used for? Aldactone is an aldosterone antagonist indicated for heart failure. The treatment of NYHA class 3-4 heart failure. The medicine has to manage edema and sodium retention when the patient is only partially responsive to or is intolerant of other therapeutic measures. Patients who have taken digitally can be indicated Aldactone when other therapies are considered inferior. This medicine is also used to treat hypertension. It is used as an add-on therapy for the treatment of hypertension to lower blood pressure. Controlling blood pressure plays an important role in reducing the risk of fatal and non-fatal cardiovascular events, primarily strokes and myocardial infarctions. Aldactone is also used to treat edema associated with hepatic cirrhosis or nephrotic syndrome. This management in adult patients is not responsive to fluid or sodium restriction, and in the setting of nephrotic syndrome, when the treatment of underlying disease, restriction of fluid and sodium intake, and the use of other diuretics produce an inadequate response. Aldactone is also used to treat primary hyperaldosteronism in short-term pre-operative treatment and long-term maintaining for patients with dyscritic aldosterone-producing adrenal edema who are not candidates for surgery, and patients with puerperal micro and macronodular adrenal hyperplasia. Aldactone is contraindicated in patients with hyperkalemia, Addison's disease, and concomitant use of allopurinol. How does Aldactone work? Aldactone or spironolactone is a specific pharmacologic antagonist of aldosterone, acting primarily through competitive binding of receptor at the aldosterone-dependent sodium-potassium exchange site in the distal convoluted renal tubule. Spironolactone causes increased amounts of sodium and water to be excreted, while potassium is retained. Spironolactone acts both as diuretic and as an antihypertensive drug by its mechanism. It may be given along or with other diuretic agents that act more proximally in the renal tubule. What are the side effects of Aldactone? Aldactone may cause some common side effects on the digestive system, including gastric bleeding, ulceration, gastritis, diarrhea and cramping, nausea and vomiting. Other common side effects include drowsiness, dizziness, lightheadedness, or headache may also occur. To minimize lightheadedness, get up slowly when rising from the seated or lying position. In treatment of heart failure, the dosage of Aldactone would be initiating treatment at 25 mg once daily, then increase to 50 mg once daily if patient tolerate it. In treatment of essential hypertension, the recommended initial daily dose is 25 to 100 mg of Aldactone. Administered in either single or divided dosage is recommended. Dosage can be titrated at 2-week intervals. Doses greater than 100 mg per day generally do not provide additional reduction in blood pressure. For treatment of edema in patients with cirrhosis, initiate therapy in hospital setting and titrate slowly. The recommended initial daily dosage is 100 mg, administered in either single or divided dose, but may range from 25 to 200 mg daily, then given as the sole agent for duration. Administered for at least 5 days before increasing dose to obtain the side effect. In treatment of primary hyperaldosteronism, administer Aldactone in doses 100 to 400 daily in preparation for surgery, for patients who have considered unsuitable for surgery. Aldactone can be used as long-term maintenance therapy and allow it effective dosage determined for the individual patient. Here are some safety advice for patients who use Aldactone. Easy and safe to consume alcohol with an Aldactone tablet. Aldactone tablet may be unsafe to use during pregnancy. Although there are limited studies in humans, animal studies have shown harmful effects on the developing baby. Your doctor will weigh the benefits and any potential risks before prescribing it to you, so please consult your doctor. Aldactone tablet is safe to use during breastfeeding. Human studies suggest that the drug does not pass into the breast milk in a significant amount or is not harmful to the baby. Aldactone tablet may increase alertness, affect your vision and make you feel sleepy and dizzy, so do not try if there are some symptoms occur. And that's all information relating to Aldactone. Thanks for listening and don't forget to like and subscribe for channel. Bye bye and see you soon in the next video.